Science Ability, the Healthy Heart Awareness, and we have Dr. Taylor, who is the Chief Cardiologist at Georgetown Hospital. Right.
Yes, so welcome guys. My name is Alan Taylor. I'm Chief of Cardiology at Medstar Georgetown University Hospital, Medstar Washington Hospital Center, which is part of the Medstar Heart and Vascular Institute here in Washington, D.C. And this is Heart Month. Every February is Heart Month. And so all month long we're tweeting on WTOP and our own website. And you can follow me on Twitter if you want at Taylor MHBI Card. And we're tweeting all month about heart health tips. So what I thought I'd do today is talk about 29 heart health tips. And why 29 in Heart Month? Because this is a leap year. There's 29 days. So you get a bonus tip this year. Instead of 28 in February, you get it 29. So let's go through these, and these are something we can all relate to. So we have 29 tips in about an hour. So number one is always make time for exercise. Exercising 30 to 60 minutes a day will cut your heart risk in half. So why is this one number one? Because it is the most important one. We start, and you think, well, I knew I was supposed to exercise, but maybe you didn't know how much it was going to reduce your heart risk. Up to half. Regular exercisers experience half the heart risk of non-regular exercisers. And you can think, well, I don't like to exercise. Well, walking is perfect exercise to reduce heart risk. Moderate walking is all you have to do. You don't have to be training for an Olympic marathon to get the benefits from exercise. So what's number two? And let's keep this interactive. If you have questions as we go, please, if you have questions as you go, please interrupt and we'll talk about them. Because if we leave all your questions at the end, we'll have too many and we'll forget to come back. Number two is to know your heart risk. You can calculate your heart risk by plugging it into some very simple online calculators. And I give the website to one of them. It's called cvdrisk.nhlbi.nih.gov. It's a government website, which you just put your own age and your gender, your blood pressure, and your cholesterol measurements from the next time you go to your doctor, whether you do or don't smoke, and you can get your risk calculated of having a heart problem over the next 10 years and figure out if you're above risk, above average risk, or below average risk. That way you know what your risk is. And knowing your risk is really important because what risk is tells us if we should use certain medicines like cholesterol medicines or aspirin, for example. How do you know if you want to use those medicines? You've got to calculate your risk, and you can do it yourself. Number three is, certainly this is about prevention, but never ignore chest pain. Pain can be felt anywhere in the chest area, the arms, the neck, or the back, and it can be heart pain. Everyone experiences heart pain when it's related to an artery blockage a little bit differently. So you have to be heart aware. And any symptom, particularly in an older patient, or sometimes women will experience symptoms very differently rather than that classic clutching their chest, fists in the middle of the chest. So be aware that any symptoms in the upper body, particularly if they're coming on with exertion or going on with rest or unusual, could be a heart symptom.
Dr. Taylor, on the lady's risk for a heart attack sinus symptoms, I understand that oftentimes they'll have experienced pain in their jaws, for example. Is that correct?
It's very different for everybody. Women often will experience back pain or up in the shoulder area, but they also experience just straight chest pain. So it's being attentive to any potential symptom for heart disease. Now, if you're an 18-year-old exerciser, and you're having back pain, it's something else. 18-year-olds don't get heart disease typically. But if you're middle-aged and older and you're having some chest symptoms or back or neck symptoms and you don't know what they are, shoulder symptoms, sudden, unexpected, shouldn't be there, best as you know, pay attention to it. Don't let it pass by. Women also often seek care for heart pains later because they're caregivers. They're not care receivers. They're always worrying about somebody else. They're not worrying about themselves. And so we have to make sure that women are in particular look out for these symptoms. Ladies, right?
She just caught me making a doctor's appointment.
I suppose to back that up and back up his comment, that is my mom actually, when she's experiencing issues, she said she went to the doctor, an internist, and he confirmed, no, you're not going through anything. And I said, that is the best situation you don't have a heart attack. But she was concerned, she did.
Better to be concerned to get it checked out. So these are all tweets in 140 characters or less, so it's fits on Twitter. So check your blood pressure. You can get your blood pressure checked in a grocery store or a supermarket or a pharmacy, and know what the number should be. A healthy blood pressure number should be below 140/90. Both numbers matter. If one number's high, it matters. It doesn't matter the top number or the bottom number. Both numbers matter, 140/90. And everyone should get their blood pressure checked on an occasion. Number 5 is...
I have a question.
Yes, please.
This is the interpreter speaking for Mitch. What's the numbers considered for low blood pressure?
Low blood pressure. Well, low blood pressure matters not as much if they're not causing symptoms. And low blood pressure, if you're having dizziness, then I would worry about what your blood pressure is. If you're not having dizziness, then not as much to worry about. Low blood pressure often is seen as a sign of health. So number 5 is, and you're going to say, well, you knew this, right? No smoking. Don't smoke, and ask your loved ones to quit. Now what you can do is, if you're not a smoker, ask someone you love that does smoke to quit. Because once you start quitting, once you stop smoking, your risk starts going down. Your heart rate starts going down within about 6 months. Within about 2 years, your risk is like you'd never smoked before. And so people will say, I've smoked my whole life, might as well keep doing it. No. If you stop smoking, your risk goes down, starts going down very quickly, and becomes that of a non-smoker within just a couple short years. So it's never too late to quit smoking. And the best thing we can do is ask the people that do smoke to quit. And you'll learn more about that in a little bit. How about aspirin? You've heard take aspirin a day keeps the doctor away. So should you take aspirin? If you have heart disease, the answer is yes. If you don't have heart disease, then you really should be talking with your doctor about it, because you maybe should not be taking aspirin. Aspirin isn't perfectly safe. It causes bleeding problems and stomach problems. It's as simple as it might sound. It's not always a safe medicine. And only if it can help you is it worth taking a medicine that has some risk. So if you're taking aspirin, but you haven't had heart disease, and your doctor hasn't prescribed it, it's probably a good chance to review, should you be taking aspirin? And maybe the answer is yes, but maybe the answer is no. Well, we talked a little bit about exercise, and tip 7 is, we talked about exercise. What is exercise that helps? What is moderate exercise? And the way to know if you're exercising moderately, because moderate exercise is where the benefit is that you should be able to carry on a light conversation while exercising. If you're at the gym and you're on a bike and your bike mate next to you asks you a question, you should be able to answer them. Maybe you want to, so a light conversation is the right thing to be able to carry on. If you say, no, not enough breath to talk right now, you're probably doing more than you need to get the heart benefit. So but you could be doing too little if you can talk a lot. So you want to be able to feel a little winded, a little sweaty, but be able to carry on a light conversation. Then you know you're exercising moderately. You're in that range where you're getting heart health benefit. Tip 8, stress. We all live in Washington and we know about stress. Is stress bad for your heart? Yes. When is it bad? When there's sustained stress. There's stress that just doesn't go away. And you can't control it. If you can control the stress or help make it go away, because look, stress is a part of life, then it's not as risky. When there's sustained, uncontrollable stress, no matter the source, money, family, job, all those things can be the types of stress that lead to increased risk for heart disease. So how do you do it? Learn to control your stress to prevent heart disease. Number 9, more on smoking. Now we talked about telling a loved one to quit. Secondhand smoke is dangerous. Public smoking bans, not smoking in bars and restaurants, airplanes, has reduced community risk for heart attack by 20%, which is just amazing. Every time a country or a city enacts a public smoking ban for bars and restaurants and so forth, heart attacks in that community go down, because secondhand smoke is dangerous. So why tell a loved one to quit? Because if they're smoking, you're smoking. And smoking is as bad for you as it is for them. So there's a lot of sensibility to public smoking bans and staying away from secondhand smoke. Now it's Heart Month, and what occurs in Heart Month is February 14th, which is,
Valentine's.
and you watch all Valentine's, and you watch all the commercials, all the various commercials that ask, is your heart healthy enough for sex? So how do you know if your heart is healthy enough for sex? Well, you know sex has a heart workload of about climbing 2 flights of stairs. And so what we tell patients is if you can get up 2 flights of stairs comfortably and you don't have any symptoms, then your heart's healthy enough for sex. And that's just a Valentine's Day month thing. All right, now on to the fun stuff. Not that the last things weren't fun. Dark chocolate. Chocolate is actually beneficial to your heart. And so I say, give your loved ones chocolate in Heart Month as a gift from Valentine's Day. Regular chocolate eaters actually have lower blood pressures, lower cholesterols, and less heart disease risk because of it. There's beneficial things in chocolate that help lower blood pressure and cholesterol and heart risk. And it's the dark chocolate in particular that has the richest concentrations of those antioxidants, those flavonoids. Dark chocolate is that, dark chocolate, it's when it's really deep, rich brown. It has about 60% of cocoa in it and a little less of the sugar in the milk and so forth than sweet chocolate. Chocolate in general has the same heart benefit, but it's the dark chocolate that's the most beneficial. So chocolate's not so bad for you. Of course, you can do anything too much. Chocolate for breakfast, lunch, dinner, and bedtime snack is probably too much, but a little chocolate here and there is good for your heart. Now, how about wine? Everyone always thinks about wine is good for the heart. So I say, in Heart Month, you go out to dinner for Valentine's Day or in Heart Month, order wine with your dinner. Moderate intake of wine, it does associate to a lower heart risk. Regular consumers of wine. But of course, what do you have to do is consume wisely. Alcohol has obviously negative consequences. There's calories. It can be safe if done not too much. Never drink and drive. But regular wine drinkers do have lower heart risk than folks that don't. Now what about tip 13, red or white wine? You've heard people say, oh, red wine is good for your heart. Well, red wine's great, but white wine is just as good. In fact, any spirits that have been associated, whether it's beer, wine, other forms of spirits, liquor, have the same health benefit. Now, red wine's great and fun. But in fact, red, white, any spirits are associated with lower heart risk. What is moderate consumption? This is about moderate consumption and everything in moderation. Moderate consumption is 2 or fewer drinks per day in a man and 1 or fewer drinks a day in a woman. And binge drinking, that is drinking too much in a single setting, is bad for your heart. So it's about drinking in moderation, 2 or fewer for men, 1 or fewer per day for women. And it's any of the alcohol spirits, beer, wine, or liquor. And red and white wine are the same for that reason. Now 14, on to food. We talked about chocolate, wine, how about food? The most heart-healthy diet is the diet called the Mediterranean diet. Studies show this diet reduces heart attack risk by up to 30%. Well, you think, well, what's a Mediterranean diet? It's not the hot dog stand at the corner, that is for sure. Mediterranean diet, as we'll go through in a minute, is a diet that lowers both stroke risk of dying, heart disease risk. And on to tip 15, the Mediterranean diet is a diet that's very rich in vegetables, fruits, nuts and seeds, herbs and spices, fish and poultry, olive oil, eggs, cheese, yogurt, and wine. Wine is actually part of the Mediterranean diet. You can think, well, that's not anything close to the diet I eat. But in fact, it's about trying to avoid the traditional American foods, things like baked goods, red meats, fried foods, sweets, sodas, spread fats, things like butter and margarine. Those are like 1 or fewer per week. And baked goods, 1 or fewer per day.
What about coffee?
Coffee, I'm getting to that. That's later.
Okay.
Your coffee is okay. Okay, so drink your coffee. But that's a tip later. That's a tip later on. But overall, the Mediterranean diet is about food choices. The reason I like it, it's the only diet proven to prevent heart disease, and it's about food choices. Again, it's those choices listed there: veggies, fruits, nuts, seeds, grains, herbs, spices, fish, poultry, olive oil, eggs, cheese, yogurt, and wine. And those sort of healthy choices are the ones that associate the lower heart risk. How about medication? So what if you have heart disease and you're on and you have heart medications you take? The most important thing is to take your medicines fully and faithfully. The only way to get the full benefit of your treatments is, in fact, to take your medicines every day as prescribed. I see too many people who don't take their medicines fully. In fact, most people take about 60% of their pills on average. So people miss on average, about 40% of their daily pills. Now you may say, well, that's not me. I always take my pills, and that's great. But on average, about 60% of pills are actually taken. People forget. There's many reasons why. And maybe there's a good reason. Pills don't make you feel good. Talk to your doctor, see if there's an alternative. Or maybe you're simply forgetting. Then things like a pill, like a daily pill box or something can help you remember. But if you're on pills for your heart, do take them as prescribed, because that's the only way they're going to work. How about exercise? Now, what about daily exercise? This is a big building here at USDA. I see there's stairs and elevators. And you can imagine that stairs are pretty good exercise. Stairs burn twice as many calories as walking. And actually, if you are regular stair climbing, you reduce your risk of early death by 15%, which is pretty amazing. So if you've got an alternative, take the stairs, take the elevator, take the stairs. You'll lower your risk of death and burn calories more than walking. So tip 18, we're in this era of what's called a quantified self. What do I mean by that? People are just measuring everything, right? Your iPhone tracks how many steps you take or how many stairs you move. There are all sorts of, you've got a watch on, your Fitbit. You've got a watch that's tracking, your heart rate and your stress level, and there's all sorts of ways to quantify yourself these days. And I think that's really cool and modern. So the idea there is to use that as a tool to help you keep moving, because moving is a good thing. We tend to sit too much during the day. Standing is better than sitting. Moving is better than standing. So keep moving. Now, by adult standards, it's 10,000 steps a day is considered very active. Sedentary would be considered below 5,000 steps a day. So, the challenge is just whatever you're doing, quantify it and try and challenge yourself to do a little more, and you'll gain health benefits from that. And those are some general guidelines for numbers. As folks get older, active means active levels are lower than this. For children, active levels are much higher than that. Think of those little legs. They got to move a lot to get around. An active child's probably doing 14,000 steps a day. So, but for adults, 10,000 is considered very active. But whatever it is, quantify yourself and do a little more, including the stairs. Now, on to tip 19, fish eaters. Most people like fish, some people don't. But fish eaters actually have less heart disease. So I'll give you my tailored tip for this. My tailored tip for this is when you go out to dinner, you eat out, think about fish as the first choice. Fish can be hard to get, hard to cook, and if you're eating out, fish is a great choice, because let the restaurant deal with getting it and cooking it. Let someone else do the cooking. But fish eaters do have less heart disease. Why? The fish oils there are lots of benefits of fish oil. And oily fishes are things like cold water fishes. Those are where most of the benefit is. They're things like salmon is a cold water fish. Tuna is not so much a cold water fish, although people really do like tuna. So cold water fishes are the ones that have the most beneficial oils in them.
What about supplements?
So fish oil supplements we recommend if folks have heart disease and they don't like or can't eat fish. Or sometimes if they have certain problems in their cholesterol measurements, we'll use fish oil for that too. So we use fish oil for treatment of cholesterol, and then if folks don't like or can't eat fish. But that's only in folks with known heart disease, that latter part. Otherwise, fish is just a general healthy choice. It's part of the Mediterranean diet because of the healthy oils in it. And again, it's cold water fish.
Quick question
Sure.
about fish oil. Alternative would be hemp oil, like THC. Would that be beneficial also, hemp oil?
I don't know about the benefits of hemp oil.
Okay.
I wish I could answer your question.
Yeah, I don't know either. That's why I asked.
I wish I knew everything. That's what Google's for. Right? All right. So down to tip 20. So this one I really love. Did you know that people who are optimistic have less heart disease? So I truly think it's good for you to see the bright side in life. It is truly good for your heart. Why? What is so important about optimism? You know, whether you have heart disease, if you're optimistic and you have a heart attack, you live longer. If you have heart failure and you're optimistic, you live longer. And even if you don't have heart disease and you're optimistic, you get less heart disease because you have less stress. Your blood pressure is lower, your heart rates are lower. So optimism is something we all can control. It builds resilience, you know, because day in and day out we get stress in life. You know, a stressful interaction at work, a stressful interaction in the family, driving, you know, whatever might bring on stress. But optimism, you know, think optimistically, and you can train yourself to do this by just seeing the bright side, and you'll have less heart disease, you'll live longer, and you'll be happier along the way. Now, 21 is an important one, and it's more new information, and it's about snoring. So if you snore, here's your heart tip, tell your doctor. Snoring can be treated, and if you're a snorer, it could signal risk for things like high blood pressure, abnormal heart rhythms, and other health conditions. So snoring used to be just something annoying, right? And we said, oh my goodness, he snores like he's cutting logs. Well, it's more than that these days. It's not just a nuisance, noisy problem in the bedroom. It actually is truly a health risk. And high blood pressure and heart arrhythmias are common consequences of snoring. So tell your doctor, easy to test if that snoring is associated with a heart risk or a health risk or not.
A question is, what if you position yourself to avoid snoring, like you sleep on your belly, you sleep on your side?
Yeah, some people will snore on their back. I think, you know, if you're getting kicked out of the bedroom because you're a snorer, probably a good thing to do. And if you're a habitual snorer, always just good to tell your doctor. Let them help you figure it out. They can do a simple sleep test, for example, and tell if your snoring is associated with stopping breathing at night. It's when folks stop breathing because of their snoring at night, or it prevents good air exchange, that these health risks come up. It's called sleep apnea, and it's very treatable. And so looking for that is important. So snorers unite. Go see your doctor. All right, 22. Now 22 is a little high tech, but I want to put it out there. If you really want to know your risk of a heart attack, and I believe that every middle-aged man and every middle-aged woman, age 50 for a man, age 60 for a woman, should know if they have artery buildups using a very, very simple test that most hospitals can do. It's called a calcium scan. It's a very simple CAT scan of the heart. It takes about 10 minutes. No needles, no fans, nothing going inside of you. Just hold your breath for 15 seconds. Bang, 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 bang. Couple quick x-rays of the heart, and we can tell if you're getting artery buildups faster than other men or women your age. Because those artery buildups take decades to develop, but later on cause heart attacks. And it is the most accurate way to tell about heart risk. It's very safe. Although it's using radiation, it's very low levels of radiation, about like 2 mammograms, which we don't even think about, right? And it costs less than a typical dinner out in the city for 2. For under $100, you can get your heart scan once in your life, and you'll know your risk. And I believe that although you know that it's a great preventative test to look for heart risk, and you'll know your personal risk and know what the right treatments are. So think about that next time you think about going out for dinner and you spend $100. Think, well, I could have gotten a heart scan for that amount.
I have a question. Would you see calcium buildup in patients that have normal cholesterol levels?
Yes. So it's a great question. What we know is that some folks, even without the typical heart risk factors, have artery buildups, because those risk factors only explain about 1/3 of heart risk. 2/3 of heart risk we don't understand. It's genetics. It's the way you've lived. It's You know, it's things we can't measure. And that's why these scans are so powerful, to go beyond cholesterol and blood pressure measurements and get the bottom line answer. If you're age 50 and you're a man, you've got a 1 in 2 chance of developing heart disease in your lifetime. If you're a woman, you're age 50, you have a 1 in 3 chance. It's a really common problem. It's our most common health problem in the country. And these scans go right to the answer and tell you if you're developing artery buildups, which are silent and develop over decades. And although some insurance companies will pay, Medicare pays for it, some insurance plans will help pay for it, and even if not, if you've got some means, and you know, it's not expensive if you think about it, under the cost of a nice dinner for 2, you can get your risk. And if it's abnormal, know that you need to do certain things, like you might take a cholesterol pill where you weren't ordinarily going to, or aspirin, or maybe it reassures you and you don't have buildups.
So there's other ways other than surgery to reduce calcium buildups?
So the calcium buildups, yes, we have ways other than surgery to reduce buildup, and those are things like cholesterol treatments and so forth. So yeah, it could really steer you to those right treatments if you've got those.
Okay, thank you.
Good question. On to tip 23. This is an important one. So, do you know CPR? Because everyone in the country today should know CPR. It is very simple, and there's a video there. If you go to cpr.heart.org, there is a very simple 2-minute video that'll teach you CPR. And it goes to that old Bee Gees tune, Staying Alive. Remember? Staying Alive. And it's that rhythm. And the thing, and they teach you to put your hands together and push hard and fast in the middle of the chest to the tune of Staying Alive. Staying alive, staying alive. So you have to push hard and fast, and it teaches you how to do that. You don't have to breathe, you don't have to do rescue breathing, it's just pushing on the chest. That alone can keep someone going long enough for rescue personnel to get there. And if you get bystander CPR, that chance of persons living through that heart arrest doubles. You can double someone's chance of living through a heart arrest. And anybody can do CPR by watching a simple 2-minute video. So, staying alive. Sorry about my Bee Gees interpretation. All right. 24. Please, please, ditch the soda, ditch the energy drinks. Soda is straight sugar, raises blood sugar, causes diabetes. There's even evidence that some diet sodas cause the same problem, cause pre-diabetes. So there is no health benefit to soda. And energy drinks have tons of caffeine and stimulants in them, and in fact are very dangerous for younger people in particular. And this is currently being looked at very carefully by the Food and Drug Administration, whether these drinks need more close regulation. But from a heart risk perspective, sugar, caffeine, lots of this caffeine and other and stimulants, we should be very careful with sodas and energy drinks. Stick to water, natural drinks, teas and so forth. But sweeteners and the amount of sugar, 9 tablespoons of sugar in a can of Coke or a can of soda. All right, you mentioned about coffee. Tip 25. Are you a coffee lover? I'm a coffee lover. For your heart's sake, coffee is okay. Okay, so drink coffee to your heart's content, but skip the donut. Okay, the donut is not part of the Mediterranean diet. Again, baked good, right? Less than or equal to 1 a day. But coffee is actually not a heart risk, so you can drink coffee to your heart's content. 26. I like this one. Do you like music? Well, your heart does like music. People that listen to music have lower blood pressure. They're more relaxed. Their heart rates are slower. So listening to music actually lowers blood pressure almost about as much as some pills do, believe it or not.
I believe it. I do this driving into work. I have to come in through Sidney Parkway.
Yeah.
And I notice I'm in a different frame of mind. I'm more relaxed.
When you listen to music.
My own music, rather than listening to the weather or listening to
Craziness.
Traffic.
There you
They're
go.
telling me you're going to have another 30-minute wait on the Parkway.
Yeah, so regular music is a way to lower your blood pressure, reduce your stress level. And so listening to music is actually a heart healthy tip. So tip 27. This is a real common question, and it's should I take cholesterol drugs? But then oftentimes people just start with the question, are these cholesterol drugs They're commonly known as statins. They're the most common cholesterol drugs we have. Brand names might be things like Lipitor, Crestor. Are those drugs safe? Now, for most patients, the absolute answer is yes. They do have some side effects, but they are, in general, quite safe. Here's the downside. Many people think that they can take some over-the-counter supplements to take as alternatives, and those really aren't very helpful. So the first question is, do you need a cholesterol medicine? And that starts with those risk calculators, knowing your numbers, so know your numbers. But then if asked to take a cholesterol medicine, there's many alternatives. They're very safe in general for most patients. You'll want to be informed about them, but if you're taking a cholesterol medicine or being asked, I think it's, don't be afraid of it. You know, they are generally safe medications, and they're so safe as to I want to reassure people that they're very important for us as preventive tools for heart disease. So very important. Now, how about number 28? If you're with somebody and they think they're having heart attack or stroke symptoms, and we talked about heart attack symptoms, chest pain, stroke symptoms, face, arm, speech, face droop, arm weakness, numbness, speech slurring, time is of the essence. So 911, call 911 immediately. Minutes matter. Minutes matter to save heart muscle. Minutes matter to reduce stroke risk. So know the symptoms, and it's chest pain for heart attacks, face, arm, speech for strokes, and then call 911. Keep calm and call 911. And then last, number 29, many folks will take vitamins and other supplements thinking that it lowers their heart risk. They go to the pharmacy store and load up on these because they think they're lowering their heart risk. And I'm just going to give some general advice, which is to be careful. Most of those, have few, if any, proven benefits to heart risk. Vitamin E, vitamin C, all these things. Even a daily multivitamin, it doesn't have any really general health benefits. So eating a healthy diet is the most important thing. You can get all the nutrients you need through just a healthy diet. And if you're taking a lot of vitamins and supplements, be careful. Again, you can spend your money however you want to, but we generally don't have any that we strongly recommend. They just have few, if any, really strong health benefits. So those are my 29 tips for Heart Month. I hope they've been fun for you to listen to. And you can follow us on Twitter and at Taylor MHBI card, or I've listed here our website for the Heart Institute to find more about your heart health goals, and our Facebook page if you'd like to follow us there too. A lot of good health information comes out. Any questions?
Going back to the calcium scan.
Yes.
Is that a test there's sometimes these heart reveals that go around?
Yeah.
Are they offered in those?
So you'll see these lifeline screenings. Those are a different test. These heart scans are really the optimal test to get, and most hospitals, all hospitals have CAT scanners or CT scanners, and most hospitals are equipped to do these special types of heart scans. And certainly if the hospital has any type of a heart program, they'll have a heart CT scanner. And most will offer either insurance coverage, or if not, they'll offer a cash pay, again, usually at fairly low cost. But it's typically at a hospital you're going to find one of these, because it is a big CAT scanner. It fits in like something the size of this room, so too big for a van. I don't generally recommend the mobile screenings. They're popular. Show up in a church parking lot and screen away. I don't know that, I think that they're trying to do something good, but I worry a little bit about the way they're sometimes conducted. They're not necessarily as quality controlled and so forth. But the intent is good. I think if I was going to steer to one test I thought was the most useful, it would be knowing your numbers, calculating your heart risk, and then a heart scan if you need additional information. It's probably your best bet.
Any other questions?
In terms of exercise, how beneficial, compared to like cardio, just lightweight cardio, how beneficial is weightlifting?
Yeah, weightlifting. So weightlifting has the benefit of weightlifting is that it'll increase your lean muscle, your lean body mass, which is very good for metabolism. Fat doesn't metabolize calories as fast as muscle does, and so I think that's where the principal health benefit is of weightlifting. But it's cardio exercise. Again, 30 to 60 minutes of moderate exercise, being able to carry on a light conversation most days of the week. And you don't. And here's, I didn't mention this, but I'll go back to it. And thanks for the question. Is that you can break that up into spurts. So you can do 10 minutes in the morning, walking from the metro stop, 10 minutes at lunch, and 10 minutes in the evening walking back, and you've done your 30 minutes. But you got to walk fast, okay? Got to walk brisk, got to feel it, and then you'll get that health benefit. If you get, what I do at work is if I'm on a telephone conference, I just put a headset on and I walk the halls. No one can tell I'm not sitting at my desk. and rather than change your desk sitting on the phone, I just roam the halls, and I'll get in tons of walking just on conference calls all day long. So again, if you're sitting, stand. If you're stand, walk. And if you're walking, walk faster and just move. And you'll be much healthier. And quantify yourself as you go. You'll be able to set goals, have fun with it, challenge your cube mates to do more.
Now, a question I have, I'm thinking specifically my parents. My dad is from the Spanish Civil War, but my mom is a baby boomer. So she has knee issues, and so like walking is really something she can't do. So what would be a good alternative? What can I suggest for the children?
Yeah. So if you can't walk or run, what's the optimal exercise? Well, it can be challenging. I would say sometimes it's just the weight bearing, so maybe biking or swimming. And swimming obviously takes a little more effort because you got to go to a pool and there's some effort involved in that. But if you're really having knee problems, first can't walk. See if you could get your knee problems fixed. Sometimes simple strengthening of your legs will help knee problems. If you go to a bone or joint specialist and get some tips on how to improve your knee pain, because a lot of knee pain can be solved by simple physical therapy and knee strength and muscle strengthening, physical therapy, and then maybe you could walk more. But if you really are confined, you can't walk. Swimming is a good exercise, but again, it has to be about that same duration, 30 to 60 minutes, and of the same intensity, moderate intensity. Good question.
Why does diabetes raise the risk of heart disease and stroke?
Right. So why does diabetes raise the risk of heart disease and stroke? Complicated question. One of the reasons it raises is because simply the high levels of blood sugar actually change proteins in the body and change the way cells work in the body, and that affects heart risk. Oftentimes folks with diabetes, because of that, also have things like higher blood pressure. They often tend to be overweight. They tend to have different cholesterol levels. And those things add to the diabetes. And so it's the diabetes plus those other things that come with it. It's an inflammatory state. Folks with diabetes often have more inflammation in their body from some of the tissue that builds inflammation. So diabetes is a complicated thing that does heighten heart risk quite a bit. And it is, although it can be treated with medicines, it starts as a lifestyle disease. Maintaining good ideal body weight and staying active actually reduces your risk for diabetes. So we'd like to shift to sort of from a diabetes standpoint, thinking about prevention, and the right diet, exercise, and body weight, a good body weight, maintaining good body weight will limit your risk for diabetes. And if you do turn out to have diabetes, controlling your blood sugar is important, and then also looking at your other heart risks, cholesterol and blood pressure and so forth. And often that's a time when folks do get diabetes, because of the heightened risk, we do use medicines to prevent heart disease. Things like cholesterol drugs or aspirin are often commonly used in diabetes. So diabetics are a very special population, and we really have to think about it on a prevention level first. But when you get diabetes, then it becomes very important to look at heart risk. Good question. It's very complicated. The answer of why diabetes relates to heart risk is very complicated.
I have another question. What is the value of a C-reactive?
So C-reactive protein, you've probably all been to your doctor, they check your cholesterol and they check a thing called C-reactive protein. It's a test that some people feel differently about. I personally think C-reactive protein is an interesting test it's a measure of just of how much inflammation is within your body. We all have some inflammation in our body at all times, right? It's just a normal part of living, right? You bump your knee and it gets a little inflamed, or you brush your teeth and you cause a little inflammation. Your body's always fighting off something, right? We are exposed to, microbes and germs all throughout the day in our lives. But some of us have more inflammation than others, and some of that comes from fat. Fat tissue actually stimulates the production of inflammation. And what we find is that people with more inflammation, and this is the sort of inflammation you're not going to feel. It's that normal level of inflammation just sitting here at this table. We're all feeling well and nothing's happening, but I have more inflammation in my body right now than you do as a natural state. Because of that, my risk is going to be higher. Folks with more inflammation have higher risk. I'll give you an example. We found that folks with things like rheumatoid arthritis, a dangerous inflammatory condition of the joints, have higher heart risk because there's chronic inflammation in the body. But back to normal people, just the level of normal inflammation you have relates to heart risk. Now, it's controversial whether the inflammation is actually causing the problem or is just a marker of the problem. In other words, whether the inflammation is doing the damage or you just see it because something else is being damaged. So without getting too much into the controversy, knowing your C-reactive protein is a reasonable thing. I think about it when I think about a cholesterol test because it modifies cholesterol risk. But it's a complicated number to interpret, so you'll have to get it interpreted with your doctor. But it's not as straightforward as one would seem, though. So if you've had a C-reactive protein test, I think your doctor's thinking very thoughtfully about your heart risk. But interpreting it's important. It can be very difficult. If it's abnormal, often we'll repeat it to make sure, for instance, you hadn't just recently had a cold and that's what caused it. You have to check it when someone's feeling well and in a state of health to know what their, again, that sort of baseline or basal inflammation is in their body. And all of us have different levels.
I have a question. Do migraines affect heart health?
The migraines affect heart health. Not to my knowledge. Not to my knowledge. There's not a connection.
Okay. The reason I asked was because one time I had a really serious migraine, and my doctor gave me some medicine that he said is thought to be able to help migraines, but is primarily used for the heart.
So migraine is a vascular headache. It's a type of headache that comes from overreactive blood vessels. And many of the medicines we use in heart disease also treat blood vessels. They relax blood vessels, as for example for high blood pressure. So there's an overlap in the treatments. I think that's what you notice is that some of the heart medicines also relax blood vessels that are used for migraines.
It'd like to kill me. I couldn't walk up a flight of steps.
He gave you a beta blocker probably.
Yes.
Yeah. Beta blockers are great medicines, but they can make you tired.
I didn't take it.
Good. Well, listen, great group, good questions. Thank you, USDA, for the invitation. Have a healthy and happy Heart Month.
Thank you.
Thank you.
Thank you.
Thank you. That was great. That was really good.